Hi, my name is Adam Funk, and I'm a birth injury lawyer. Today, I'm going to talk to you about oxygen deprivation during labor and delivery. First, let's talk about how does oxygen actually get to the baby? Well, as many of you probably know, obviously, as mom breathes, the baby breathes. The oxygen gets into mom through her lungs. That oxygen gets into the bloodstream. That oxygenated blood, then goes into the placenta. And then the placenta provides it through the umbilical cord to the baby. And that's how babies breathe. There are times during labor and delivery where that oxygen does not get to the baby properly, and the baby is deprived of the oxygen. It's called oxygen deprivation. There are several ways that this happens. First, the easiest explanation would be mom. Mom, for whatever reason, is not breathing, is not getting enough oxygen. Could be that she has an infection, could be that she has diabetes, something to that effect that is not allowing the oxygen to get into mom in order to get into the baby. However, internally, there could also be a problem that is happening with three different mechanisms. First is the umbilical cord itself. It could be that the umbilical cord is compressed or it is tied in a knot. It could be that the umbilical cord is wrapped around the baby's head or neck. It could also be that the umbilical cord has prolapsed, meaning it is entered into the birthing canal or the vaginal canal and is coming out. That could cause a kink in the cord itself and not allow oxygen to get through. Very similar to a garden hose getting kinked and water not being able to get through it. The second way oxygen can be deprived from a baby is the placenta. We talked about the oxygen getting in through the placenta and then the umbilical cord. But if the placenta itself has some sort of issue, then that can cause oxygen deprivation. Placentas at times can do something called abrupting. It's called placental abruption. It's when it tears away from the inside of the womb and therefore loses a lot of its ability to carry oxygen through. That's a problem. The third issue could very well just be the baby itself is aspirating or choking in some way. It could be because of a meconium release. That's the first stool that a baby releases. And it stains the amniotic fluid that's in the sac itself before the baby is able to come out. That baby can then choke on the meconium while still in mom. Oxygen deprivation is something that is extremely dangerous. If there is deprivation, what ends up happening is oxygen doesn't get to the brain. Without oxygen, the brain tissue begins to die. Unfortunately, our brain tissue as humans does not regenerate. And so if it is dead, it will not come back. Any type of oxygen deprivation can slowly kill off brain tissue. The question is how much? Very severe cases cause a lot of brain tissue death, which can cause a huge host of injuries to the baby. There are ways, though, to see whether oxygen is being deprived. You will see it mainly on the fetal heart monitoring strip. That is the strip that has a measurement of the contractions as well as the heartbeat of mom, as you can see here in the blue. Those allow the nurses and the obstetricians to review how the baby's doing on the inside. From those measurements, they're able to determine whether baby is getting oxygen. If it shows that baby is not getting enough oxygen at that time, then a decision needs to be made. Decision of whether to take the baby quickly is very important. What we say in the business is it's 30 minutes from decision to incision. If a C-section is required, then a obstetrician needs to make that decision very quickly and within 30 minutes be cutting open the mom on the operating table. That's how important it is. So oxygen deprivation is a very known risk that happens during labor and delivery. It's something that should always be watched out for and always be reviewed and scrutinized by the nurses and obstetricians because it can cause a host of injuries. My name is Adam Funk. I'm a birth injury attorney and I handle cases of oxygen deprivation.